Hello, my name is Kerrie, and in this video we will be discussing the two articles for this week's reading. To give a short introduction, the first article discusses the healthcare systems as they are increasingly promoting self-management of chronic conditions outside of traditional clinical environments. The self-management is often done through technologies that support patient self-care and engagement with medical professionals. In recent years, there has been an increased interest in the potential of home-based health monitoring devices and applications. The first article specifically explores specialist care provision in cystic fibrosis and enablers and barriers to technology in this context, while also highlighting the importance of its integration into the chronic care cycles, practices, and structures of cystic fibrosis care. The second article discusses patient experience as health providers embrace telehealth. Since face-to-face visits are still preferred by many, 90% of healthcare organizations say they're using or piloting remote care services to boost care condition and manage at-risk patients, as well as broaden health efforts. Through telehealth programs, more and more patients can have remote consults and other virtual healthcare options.
Hello, Danny here. Cystic fibrosis is a life-threatening disorder that damages the lungs and digestive system. There have been advancements to make it easier to accommodate individuals with cystic fibrosis in everyday life. Self-care work for CF is demanding, so researchers look for ways to adapt to the needs of individual patients. One such method is something as simple as general-purpose mobile phone reminders, which will remind patients to take medication at designated times. Another example would be something like body-worn glucose monitors that would help patients manage CF-related diabetes. The importance of CF care in day-to-day life is extremely important, as it allows patients to have better quality of life.
Hi everybody, my name is Priscilla and I'll be speaking about this week's article regarding technology to improve cystic fibrosis. Cystic fibrosis, also known as CF, is a genetic disease that affects both the lungs and digestive system of a person. Cystic fibrosis causes symptoms such as chronic cough, lung infections, as well as the inability to gain weight. Due to the severe symptoms, those with cystic fibrosis need to visit specialized outpatient clinics more frequently with longer appointments. This article speaks more about the value trade-offs when designing technologies and systems that work with chronic health conditions like CF. From the perspective of one who suffers from this disease, one may feel as hospital visits start to become a burden as the frequency and duration increase. With possible technologies, one with CF would appreciate something that can not only monitor and record their daily symptoms and health records, but also be able to do something like predict if one's health is deteriorating or improving based on the data collected from maybe a machine like a spirometer. By having devices that can not only record one's health status, but are also able to communicate with providers about patients' health without visiting them as often is a benefit to both parties. Another benefit of creating technology for those with CF can help with the time and management that one has to go through. An idea that can be implemented to help those with CF could be an app that reminds the patient on which medication to take and what exercises should be done and when they should occur. Although these tasks and routines are burdensome, it would be helpful if this app can also have some self-care activities to put the patient at ease. With technologies like this, hopefully other professions will be able to gain inspiration and insight to use these ideas on similar or different illnesses. Thank you.
So, according to Healthcare IT News, telehealth is becoming more commonplace as many more healthcare providers are offering remote services. According to the HIMSS report, 9 out of 10 offers some form of remote care, such as monitoring or consultations. As it is still relatively new, many places are still not well equipped with the technology to handle real-time patient interactions, such as video calls or messaging. Of course, with the introduction of new technology in healthcare communication comes skepticism about how effective it can be. It also raises various concerns about accessibility of remote care due to its heavy reliance on modern and oftentimes costly technologies, such as smartphones and internet. Another point of concern would be the security of sensitive information through digital mediums, but overall people are becoming more accepting of remote care and telehealth.
Hi everyone, my name is Ava and today I'm going to be discussing the second article. Remote consultations between doctors and patients have become more and more popular in recent years. However, it has been found with HIMSS research that 42% of providers say that their patients prefer face-to-face interaction and consultation. Using this technology brings rise to several concerns for patients, including the issue of accessibility. Patients who don't own a device with a video camera that would enable video chat are at a disadvantage, and another issue is that there's a lack of knowledge in how secure this process really is. For my last job, I worked as a receptionist at a beauty medical office, and in order for us to see new patients, they had to set up a video consultation with our nurse practitioner through text message in order to get cleared for treatment. And I really got to see firsthand the kind of struggles and the benefits with using this technology, and that I noticed that a lot of patients weren't really fond of it, and they were a bit uncomfortable with having to FaceTime a nurse, and a lot of them actually expressed that they would rather just walk in and get to meet with her right then and there. But I also did get to see how it was a lot easier to not always have to have the nurse there, and patients would be able to text her to set up a consultation before having to come all the way in. And if they weren't cleared, then they didn't have to come in the office at all. So I think there are pros and cons to this technology, but I think that with time we can work through the cons and it'll be a beneficial system to put in place.